The history of HIV treatment has been quite a fraught process. At the beginning of the epidemic there was absolutely no treatment at all for HIV/AIDS itself. It was possible to cure some of the opportunistic infections people with an impaired immune system suffered from with antibiotics or other drugs, but ultimately nearly 90% of those diagnosed in the early days with AIDS died. As we have said, early drug treatments such as AZT&D were able to prolong people's lives but were unable to control the virus for long, and people still died in high numbers. From 1995, new treatment methodologies meant that people stopped dying from HIV due to heart. It was thought at first that treatment based on the heart approach and with ever more advanced medications may eventually cure the virus. Unfortunately, this turned out not to be the case. Early heart treatment was also blighted by a lot of side effects which led many people to not stick to their medication due to the unpleasantness of these. Once again, this resulted in the development of further resistance. Resistance itself has been a problem with HIV treatment from the time of the first available drugs due to HIV's ability to mutate so readily. Indeed, the development of resistance to medications has resulted in a number of multi-drug resistant viral strains which, due to a lack of available treatment, could potentially be more dangerous in the future if they were ever to spread outside the populations they are currently confined to. HIV's ability to mutate so readily is the reason why no effective vaccine has yet been developed. Even within a single infected individual, there is so much genetic variance in the HIV they are carrying that targeting HIV with a vaccine using methods currently available is almost impossible. Some promise is being shown in terms of injectable antibodies which may prompt the immune system to attack HIV even in the places where an active virus can hide. Newer drugs are being developed all the time, including the entry inhibitors we spoke about earlier. Other development coming in the future include the possibility of implant-administered HIV medication, based on the technology used to administer the contraceptive implant at the moment. Microbicides applied prior to sex on the internal and external surfaces of the body have so far showed less than 100% reliability in preventing the spread of HIV. Finally, it is now possible for some people living with HIV to take just one tablet a day to control their HIV. This one tablet contains 3 medications from the various classes in a single dose, eliminating the need for multiple medications to be taken at different times, reducing complexity and missed doses, resulting in increased adherence.